So, Asmita and Manasi, shall I try sharing my screen before the participants joins? Just to, let me try share my screen.
Sir, we are live on YouTube, IN YouTube channel, so we are audible and visible to the attendees and as well as
Yeah, fine,
attendees on the YouTube.
fine, fine. So I will start just the introduction slide only. I will be sharing.
Okay, sir.
Dear attendees, uh, please note that right now there is nothing playing. There is nobody speaking right now. These are just instructions that we are displaying. And for about another 10 minutes or 8 minutes or so, you have time to check your laptop, your connectivity, and where you want to place yourself, and finalize everything by 5:30, because 5:30 sharp we will begin the quiz. There are a few people who have asked whether there is another platform to answer questions. No, it will be Zoom. In your menu at the bottom of your screen, please check for a polls icon. There'll be bars which look like a graph. That is the option that you need to use to answer questions. So when the question is active, you will be able to see the question there. Right now, you will not be able to see any questions. Once we begin the quiz, only then it will directly. But by any chance, if you feel that there seems to be some activity while you are not able to see the question on your screen, you need to go to this icon particularly and click on it, and then the question will appear and you can answer. And I repeat, quiz will start at 5:30 sharp. And I request participants to please not raise their hands. Any questions that you have, you can put those in the Q&A box, please. If you're not able to find the polls icon, you need to either scroll the menu to the right or the left, the menu at the bottom of your screen. If you're using a laptop, there may be an option of more with 3 dots. You can click on it and you might get the polls option there. Please note that the polls icon will come when the quiz is active. You won't find the polls icon right now. When the question is active, that is what I said, that when the question is active, you will see the polls icon. But in case if you feel that you can see the question, there'll also be a PowerPoint for you to read the questions just in case. So if you feel that there is a question displayed in PowerPoint, but you are not getting the option to answer your question anywhere, then you need to click the polls icon. When the question is active, the pop-up will automatically come. But just in case if it doesn't come, you need to click the polls icon.
Alex?
Good afternoon, ma'am. Good evening, ma'am.
Hi, Asmita.
Good evening, madam.
Yeah, good
This is
evening,
Dr.
Alex. Yeah, Alex.
Good evening, ma'am.
Hi, Neeraj.
Hello.
You'll be putting your video.
No videos, ma'am, only PPT.
Okay. So, Alex, is Rohit joining? Any idea?
I think he told some issues
Yeah.
joining, but yes, when I called yesterday, need to confirm. Means no confirmation. Dr. Dheeraj just
Is it
agreed to
already
join.
live, Asmita? Asmita, is it already live?
Ma'am, we are live as in, we have opened the room for the attendees to join.
The participants can hear me if I'm going to
Yes,
discuss anything?
participants can hear you. Yes,
Okay,
yes.
okay.
So another thing, I think, Dr. Alex, since a lot of people have this question about where to find the polls icon, we will launch one dummy question so that
Yeah,
all of
sure.
them get an idea.
Yes, yes.
Asmita, let me know when we are good to go so that we can start.
Ma'am, that is what I wanted to ask. That do we want to begin or do we want to wait for Dr. Bhatia?
He told me that there's going to be an issue. He'll be joining a bit later if possible. That's the
Okay, all
reason.
right.
Okay.
All right. So then should we launch at least the dummy question?
Yeah, I think that would be better.
Okay, because then after that also, I think we'll take about 1 or 2 minutes and then actually begin the quiz so that everybody is set.
Okay, fine. Yeah.
Yeah. Okay. All right. We are launching the untitled poll. So all of you, irrespective of whether you're using a laptop or a phone, you will get a screen of a question which will be in a pop-up format and you will be able to answer. It is titled untitled poll.
Uh, 10 seconds remaining.
So I see that out of 132 people, 110 people have participated in the poll which we had just launched. I hope all of you are now acquainted with the system. Is there anybody who has any questions? Dr. Sai Reddy, we just launched a dummy question, I think. Dr. Alex, do you want to begin?
Yeah, I'm just discussing with Dr. Just will inform.
Sure, sure.
Yeah, good evening, everyone. Good evening, Dr. Netra Madam, Dr. Neeraj, and all the participants and the digital team. We shall start the quiz now. I shall share my screen.
Alex, we are good to go now.
Yes, ma'am.
Okay.
I will start with the instructions.
Yeah.
Yeah, so welcome you all to this IMMUNOBLAST, which is the national level quiz on neuroimmunology, conducted under the autoimmune disorder subsection of Indian Academy of Neurology. So just I will rush through the important instructions. It is ideal to attempt the quiz from a laptop or a desktop, though you can. It is available through smartphones also. You need to have a stable internet connectivity with good bandwidth. And here actually, if there's a tie in the score, we will apply the first rule. That means the person who got the highest number of correct answers in the shortest number of time will come in the top of the list. So there will be a set 60 questions. There will be 30 sets with 2 questions in each set, and at a time you can answer 2 questions. And for answering the set of 2 questions, you will get 2 minutes. After 2 minutes, you will not be able to further answer that set. And finally the list of toppers from all institutions, that is one top one participant per institution will be made, and the top 2 from each regional zone will be selected for the final quiz, which will be held at ICTRIMS Chandigarh in November 2024. So I think it's clear, and you have given the trial also. So at a time you will get a set of 2 questions, and you answer those 2 questions in 2 minutes. So without any further delay, I am moving on to the first question. This is regarding the major histocompatibility complex, which is involved in immune response. And the next question, you can answer both the questions together. Next question is, what is the mechanism of action of MMF?
Ten seconds remaining.
So we'll move on to the next question. Which are the US FDA approved drugs for neuromyelitis optica spectrum disorders? And the next is regarding the McDonald criteria for multiple sclerosis.
Ten seconds remaining.
Passing to the next question, fifth question. Which of the statements is true regarding ravulizumab? And the next question is regarding the side effect of evobrutinib. It's an all accept question. Second question.
Ten seconds remaining.
So this is the question number 7. This is regarding the CD markers on immune cells. All are true except. Next question is an assertion reason type.
Attendees, 10 seconds remaining.
Coming to the 9th question. All are true regarding Olympus trial in multiple sclerosis except. And next question, which is a reversible BTK inhibitor?
Ten seconds remaining.
So next question number 11. Black hole in MRI of a multiple sclerosis patient, what does it indicate? And the 12th question is about inebilizumab.
Ten seconds remaining.
Moving on to the 13th question. This is regarding Kelch-11 autoimmune paraneoplastic manifestation. And the other question of the set is about the cell surface antigens.
Ten seconds remaining.
So moving on to the next question. This is regarding autoimmune encephalitis with diencephalon involvement. All accept. And the next question is an assertion reason question.
10 seconds remaining.
Moving on to the 17th question. This is regarding the drugs contraindicated in myasthenia gravis. And the next question is regarding EGPA.
Ten seconds remaining.
Moving on to the next question. What are the FDA approved indications of rituximab? And the next question in the set is a clinical scenario. Please go through it to answer it.
Ten seconds remaining.
Moving further to the question number 21. This is regarding Behcet's disease, all except. And the next question is regarding neurosarcoidosis.
Ten seconds remaining.
So moving on to the next question. Which of the following statements is incorrect about CNS vasculitis? And the next question in the set is the sensitivity of VEP in multiple sclerosis.
Ten seconds remaining.
Moving on to the next question. What does PASET stand for? And the next question is about the favorable prognostic factor for multiple sclerosis.
10 seconds remaining.
Moving on to the next question. This is an assertion reason question. Please go through it and answer. And the next question is regarding drug trials in multiple sclerosis.
Ten seconds remaining.
Moving on to the next question. This is regarding the drug masitinib in ALS. And the second question of the set is regarding the phenomenon of energy.
Ten seconds remaining.
Okay, so those were the first 30 questions. Now I would request Dr. Neeraj Baleni, who is the co-quiz master, to take over for the next 30 questions.
Thank you, Alex. Just let me share my screen. Are my slides visible?
Yes, it's visible.
Okay. So next question number 31 is regarding experimental allergic or autoimmune encephalitis, how it is produced in susceptible animals. And next question in the set is regarding the protective effect on multiple sclerosis among the following.
Ten seconds remaining.
Next question is regarding ganglioside antibodies associated with Bickerstaff encephalitis. And for the second question in the subset is a typical seizure with some clinical findings. You are suspecting an autoimmune encephalitis. You have to mention which encephalitis we are suspecting.
Ten seconds remaining.
So next question, antibodies associated with autoimmune or paraneoplastic extrapyramidal syndrome among the following is? Subsequent question is regarding aquaporin 4 antibodies belong to which subclass of antibodies?
Ten seconds remaining.
Okay. Next question, in addition to central nervous system, aquaporin 4 is present in following structures. Subsequent question is a clinical question. Just go through it and you have to tell us what MRE findings you are expecting.
Five seconds remaining.
In its question is regarding aquaporin 4 antibodies. Which of the following method have highest sensitivity and specificity? Next question is this the 50-year-old male with symmetric sensory loss and sensory ataxia for 5 months. NCS findings are given, you have to tell what you will find on serum electrophoresis.
Ten seconds remaining.
So next question is regarding following among the following, which features point towards autoimmune nodopathies rather than CIDP? Next question, you have to answer which antibody is associated with multifocal motor neuropathy.
Ten seconds remaining.
Acetylcholine receptor antibodies are IgG1 and IgG3 subtypes, but Musk antibodies are dash subtype. Next question is regarding SPMS, which DMT has shown efficacy for reducing risk of disability progression.
10 seconds remaining.
Next question is regarding anti-JCV antibody monitoring in patients of MS on natalizumab. If JCV antibody are negative at baseline. And in next question in the same set, you have to tell characteristic features of trigeminal neuropathy in Sjogren disease.
Ten seconds remaining.
So, while evaluating a 65-year-old male for peripheral neuropathy, again serum electrophoresis was done, and you have to tell which subtype of M protein is least likely to present, but if present, always signifies myeloma. Next question is on rituximab in NMOSD. Just go through it and answer.
Ten seconds remaining.
So next question, a 44-year-old man had right-sided tinnitus, sensorineural hearing loss, and dizziness and along with complex visual dizziness are exaggerated by complex visual stimuli. And within 5 months of onset, he had diplopia, and he was evaluated and found to have mediastinal mass. And we are suspecting an antibody associated with this condition. You have to answer that. Next question is regarding alemtuzumab.
Ten seconds remaining.
Which of the following is the category 1 indication for plasmapheresis according to American Society for Apheresis? Subsequent question is regarding which of the following vaccinations cannot be or should not be given in a patient who had received IVIG in last 3 months. True about Morvan syndrome is, you have to answer one. Next question is regarding a patient with multiple sclerosis who is saying something to you in your clinic. You have to determine which phenomena is this.
Second remaining.
Following drugs for multiple sclerosis are to be avoided in a male who is trying to father a child. Next question is regarding half-life of IVIG.
Second remaining.
So according to diagnostic criteria for an MOST, without aquaporin 4 antibody positive, how many core clinical criteria characteristics are required? And next question is regarding anti-NMD receptor encephalitis.
seconds remaining.
Last set of questions for today. So risk factors for poor 1 year functional outcomes in NMD encephalitis among the following is. And next question is regarding NEDA4 in MS.
Ten seconds remaining.
So that was all for today. We hope that you enjoyed taking this quiz. And the preparation of results will take around 10 to 15 minutes. So by then we will just run through the answer key in few seconds.
Dr. Netra madam has to leave, I think. She's the chair of this session and convener of autoimmune disorder subsection of IAN. Over to you, madam.
Alex, you'll be showing the answers to them before you display, or how is it now?
We will while the digital team prepare the rank list, we will just go through the answers.
Yeah, I think you can finish that.
Okay, madam.
So I thank both of you for being part of this. And I also want to thank the attendees who have come, all the residents who have come through. So basically, this is going to be, when will you have the next session, Alex?
Madam, we will have another round for the wild card entry selection. Two from this, 8 people will be taken for final round, and 2 wild card entries will be taken from the another quiz, which will be conducted after the webinars before the extremes. So the questions for that will be predominantly from the webinars. So the attendees or all participants are requested to pay attention to the webinars of autoimmune subsection weekly webinars.
Okay, I think you people can go ahead with the answers.
Yeah, over to you, Neeraj, Dr. Neeraj.
Okay, I'm just sharing. So we have highlighted the correct answer. So I will slowly go through the slides so that the attendees can tell you what they have answered. So question 1, answer was A. MHC is present in all nucleated cells. Question 2, mechanism of action of mycophenolate mofetil is inhibiting inosine monophosphate dehydrogenase enzyme. So, the correct answer among this is 1, 2, 4, 5. In abilizumab, cetralizumab, eculizumab, and ravulizumab. And regarding McDonald criteria, 2017 versus 2010, all of the above. So which statement is true regarding ravulizumab? Maintenance doses are given at 8 weeks interval. Regarding question 6, evobrutinib, that is a Bruton tyrosine kinase inhibitor. Common side effects are all except cardiac arrhythmias. The question number 7, correct answer is A. CD20 is widely expressed on the surface of plasma cells and pro-B cells. Question number 8, answer is C. Both assertion and reason are false. Question number 9 regarding Olympus trial. So answer is B. Question number 10, fenebrutinib is a reversible BTK inhibitor. Answer to question number 11 is C. Black holes are due to irreversible tissue damage due to severe demyelination and axonal loss. Question number 12. Inabilizumab is a humanized monoclonal antibody against CD19. Question 13 regarding KLH-L11 antibody. True except answer is A. It manifests predominantly as limbic encephalitis phenotype. KLH-L1 manifests as vertigo, hearing loss, tinnitus, diplopia, and all those symptoms. So among question number 14, answer is D. 3, 4, 5, they are cell surface antigens. Question number 15, all are true except anti-Hue. Question number 16, answer is C. Question number 17, answer is A. Penicillamine has the highest risk of worsening myasthenia gravis. Question number 18, all are true except answer is C. Question 19, rituximab is approved by FDA for answer is 1 and 4 B. Question number 20, answer is tocilizumab. This is giant cell arteritis. Tocilizumab can be used for treatment of giant cell arteritis. Question number 21, all are true except D. Again, regarding neurosarcoidosis, what is true about neurosarcoidosis? Answer is among these is C. So incorrect statement regarding CNS vasculitis, answer is B. Question 24, sensitivity of visual evoked response in MS is around 80 to 85%. Answer is D. So question 25, answer is B, paced audiometry serial addition test. Question 26, C is the answer. Impairment of sensory pathway as initial symptom is a favorable prognostic factor. Question 27, answer is D. Question 28, Ontario ocrelizumab, it is wrongly matched. Question 29 regarding masitinib, Which of the following is false? Answer is A. Question 30. Answer is C. Question 31. Experimental autoimmune encephalitis produced by immunizing with CNS myelin components. Answer is A. Question 32. Answer is C. HLA-A02 has protective effect on MS. Question 33. Anti-GQ1B antibodies are associated with Bickerstaff encephalitis. Question 34. This is a clinical question. Patient has fatiobrachial dystonic seizures with piloerection. It's LGI1 associated encephalitis and thymoma may be associated. So CRMP5 among the following is associated with, may be associated with extrapyramidal syndrome. So answer is C for question 35. Question 36. Aquaporin 4 belong to IgG1. Answer is B. So in addition to CNS, aquaporin 4 is present in kidney, stomach, and lungs. Answer is A. So in question number 38, it's a MOG syndrome, and typically we see spinal cord involvement with conus medullaris involvement in MOG syndromes. Answer is C. And question 39, cell-based assay has highest sensitivity and specificity for aquaporin 4 IgG detection. So M protein found in such condition, answer to question 40 is IgM kappa. Question 41. So tremor, ataxia, and dysautonomia present in a patient that looks like CIDP, suspect autoimmune nodopathies. Question 42, answer is D. Question 43, Musk antibodies are IgG4 subtype. Answer is B. And question 44, Siponimod is the only DMT that has shown reduction or reducing the disability progression active SPMS in trials, although many drugs are FDA approved to use. Question 45, if baseline anti-JCV antibody negative, then we have to monitor every 6 months in a patient who is having natalizumab for MS. So question 46, answer is A. Question 47, answer is IgGD. It's the least subtype that is found in electrophoresis, but if present, it almost always signifies presence of myeloma. Question 48, answer is C. Question 49, again KLH-L11, vertigo, dizziness, diplopia, and mediastinal mass. Question number 50, answer is D. Question number 51, again answer is D, CIDP. Question 52, live vaccines we can't or we should not give in a patient who had received IVIG in last 3 months. So MMR and varicella is the right answer, B. So in Moore syndrome, question 53, answer is D. So this question 54, this is Uthoff's phenomena in a patient who had optic neuritis in previously. Question 55, answer is C. Question 56, answer is A, 3 to 4 weeks. Question 57, answer is 2. At least 4 clinical characteristics are required if aquaporin 4 are negative. 58, question 58, answer is C. Question 59, answer is C. Question 60, answer is D. So the winners from this and 2 wildcard card entries, then they have to compete at ICTRIMS Chandigarh between 14 to 16 November. Final date we will let you know.
Good evening, sir. Dr. Dheeraj Khurana is there with us.
So,
We welcome you, sir, to this.
Everyone, sorry I couldn't join.
good evening, sir.
Hi, Neeraj, good to see you. Hi, Netra.
Hi. Alex and Neeraj, there are 2 queries which has come up in this one before you declared the results.
Yes, ma'am.
One is, I do not know which was a question on affirm natalizumab. The other one was about Oratorio and Ontario trial. I do not know which question. If you can just clarify
Yeah,
that.
what was the
People-
question on iPhone? What was the question?
If you can just clarify that.
Where is the question? I cannot see.
Dr. Bharat and Dr. Sai Kiran, can you please tell, do you remember which was the question number?
Okay. Oratorio is for ocrelizumab. Ontario is for ofatumumab.
Yep.
So that's the catch.
And what was the affirm question?
Affirm is for
Affirm is for
alemtuzumab.
natalizumab. Affirm was the original.
Affirm is for alemtuzumab. The
No,
question
no,
was
affirm
which one
for
was wrongly
natalizumab.
matched.
Oh, wrongly matched. So affirm is
Okay,
was
okay.
the natalizumab trial. Yeah.
Yeah. Question was which one was wrongly matched.
Okay. Affirm trials were the natalizumab Tysabri trials.
Alex, affirm was for natalizumab only, right?
Oh, sorry.
Yeah.
Let me check
Affirm
the
was for
question.
natalizumab.
Yeah, affirm is natalizumab trial actually.
Yeah. Sorry.
What is the question? I don't know.
So that's the reason I asked you what was the question.
1 second. I will go through the question.
Some more queries which have come up. Yep. They're all writing. This option is also wrong. Affirm natalizumab. Yeah.
Yeah,
So
we will
not for
that was a
ocrelizumab.
mistake actually. We will have to delete that question.
Yes.
So based on that, even the marks have to be changed, right?
Yeah. That question will be deleted.
Asmita from the digital team, can you make a note of this?
Yeah, we'll change the questions answer,
That's
but
the
it will
question
take
number
time
28.
yeah, it will take time, sir.
Yeah.
The question number 28. And the
Yeah.
correct answer is?
No, I
None.
think we'll have to delete
We'll have to
that
delete that.
option
Actually,
itself.
two wrong answers are there.
Wrongly matched
Yeah.
are Ontario as well as the
Okay, so we
Affirm.
have to delete
Two
question number
wrong answers.
28.
Yeah,
Yes.
we'll have to delete the question number 28.
There are
Okay,
two
okay.
answers.
No.
So how long it may take, Asmita? Approximately? For the results to be declared?
Ma'am, around 10 minutes. Meanwhile, you can take queries related to question or discussion about the question.
Okay. So we just want to tell the residents that every alternate Fridays and Saturdays sometimes we'll be having the webinars. So once today the results is going to be declared, after the end of the webinar, that is around a month before the IN Con is going to be the next quiz, where as Dr. Alex mentioned about the wildcard entry which will be selected, and then the final is going to be in ICTRIMS at Chandigarh in November.
So what is this other next quiz that's going to be for?
So they'll be having another quiz where it is going to be more predominantly based on all the talks which is covered in the webinars. So
Okay.
based on that, there is going to be the quiz so that the residents will attend them, and then they'll be selecting two more.
Two more of them. Okay.
Yeah.
So the same people compete again who've already competed? They should be.
Yes. Alex, you're muted, Alex.
So those candidates who did not make up into the top list need not get disappointed. You have got one more chance to contest in the
Yes.
final in ICTRIMS at Chandigarh. And I would also like to tell some more instructions. So 8 toppers will be selected from this. Please send an email, a letter from the HOD to the following email IDs that they are currently undergoing DM or DNB program with the year of the course and the name of the institution. As already announced, there will be a wildcard entry.
So total, how many candidates should be there for the finals?
Total 10 candidates will be there, 8 from this and 2 wildcards.
2 more, 10.
Yeah,
Okay, good.
yes. So they will be also be given bursary as
Yeah, we've already
handled
promised that. So
by
that
the
will be.
organizing team, Dr. Dheeraj sir, and to attend this finals.
So bursary
attend
would
the
include
exams.
the
Bursary would be
registration,
registration and travel, right? Or even
registration and
accommodation.
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 Travel, we'll closer to the date, we'll see how we can do that. But we could be right now. It's registration and the
Accommodation as of now.
2 nights accommodation.
Yes.
So Alex, there was also another discussion about having based on the zones, right? So now if you're going to declare the winners, what about that?
Sorry, madam.
We had decided that we will have entry-wise from different hospitals. For
Yes,
example,
yes. So
so
we
if
will
you're going to
the
declare the top 8, then
top 8 will be like it will be like one per institute only. We will first make a list of the topper from each institute, and on the basis of the region, we will select the toppers from that. 2 toppers from each region: south, north, west, and east.
and
So
also
to ensure the regional balance. So for
they all
example, if
should
2
be
people are
residents. They all should be residents, and they should
residents
have a, because last
currently
time there was
undergoing
some issue. Yeah, they should be undergoing residency, and they
residency,
should have a letter from their head of the
head
department
of
or
the department.
institute.
Yes.
Only then they'll be eligible for the finals.
Yeah. Yes. So if 2 participants from the same institute has topped, only the first of the topper will be selected from that institute,
So
and the next
you're
chance
going to
go to
take
the corresponding
2 from one from each institute. So maybe
one from each institute, and from
2
that
from each 2 from
2
each.
from each zone, north, south, west,
Yes,
and
I
east,
got
to maintain the regional balance.
agreeable. And then the wild cards could be from any region.
Yeah, wildcards, it's open to all, and the questions will be predominantly from the webinars of the autoimmune subsection.
Good.
So the next session is going to be on 20th of July, and that is going to cover on the MRI in CNS demyelinating disorders. This is going to be on a Saturday, 20th of July, Saturday.
Yeah, thank you, ma'am.
There have been also some queries in the question and answer about when is going to be the wildcard round. We will be announcing it at least a month before, so that you people are aware of it. It is going to be after the sessions, and some sessions have been stopped in view of the INCon and multiple subsection meetings. So most probably it will be somewhere around September or October. So that will be announced in a month before.
And I would
Another
also
question is regarding acute black holes can be seen with edema and inflammation, but it is a single best answer, and so it is the chronic damage. The characters description is for the chronic irreversible damage
yes,
from Miller and Moore.
yes, that's right. And another thing I would also like to announce that everyone should try to submit an abstract. We have separate bursaries and awards for the abstracts too for the residents. And that would also help them, get a bursary.
Yes, somebody has asked regional toppers. All the institutes will be divided into 4 regions, and from each region, 2 toppers will be taken, and ensuring that those 2 are not from the same institute.
Digital team, Asmita, do we have the results? How long? Asmita,
Ma'am, we are still working on the results.
if it's going to be delayed,
But do you want to declare them now? You can see them
yeah,
later.
we can
You will-
declare it in the next
on
on 20th of
some
July.
time to look at the regions.
Yeah, during
Yeah.
the webinar, we can
Take
declare.
I think we can declare it in the next webinar.
In the next webinar, you can declare it, I think.
Okay, then once the result is done, I'll give you a result, share with Dr. Alex, with you and Dr. Bhatia.
Yeah.
Yeah, and we'll declare the result on next session.
Yes.
Right. That should be the right thing.
So I thank all the residents who have joined this program and who have come quite a good number to participate. So we'll be declaring the results in the next on 20th of July. And thanks Dr. Dheeraj, Dr. Alex, and Dr. Neeraj for having
Thank
been
you.
there. Thanks Asmita and the digital team for being part of this. I know it was last moment, a lot of changes were there, but you've been very proactive and helpful. Thanks a lot.
Thank you, and hope to see you all at the ICRIMS Chandigarh and the maximal participation from the residents. And please also encourage your residents at your institutes, respective institutes.
Thank you. Bye,
Okay, good
everyone.
night.
Thank you all. Thank
Bye.
you all, the participants. Thank you.